Uh, we're going to be joined for the next few minutes, about a half an hour, by Chika Agbassi, Patricia Hain, and Irene Ward. Chika is a research methodologist with the program in evidence-based care at the McMaster University in Canada. Specifically, that's in Hamilton, Ontario. She works with other experts as a guideline development specialist. And like all actually of our reactors, she has experience developing clinical practice guidelines and also working on endorsing, updating, or adapting and adopting existing guidelines. Patricia Hain, she joins us from the Cochrane US Network, the University of Colorado Affiliate Center. She's an associate professor of physical medicine and rehabilitation at the University of Colorado's Anschutz Medical Campus. Her research focuses on the effects of exercise on people with Alzheimer's. She's also involved with, as I mentioned, with developing clinical practice guidelines. So she's a fellow of the Gerontological Society of America and the American Congress of Rehabilitation Medicine, often people call that ACRM, which in 2018 selected her for its Women in Rehabilitation Science Award for her excellence in rehabilitation sciences. She's also an associate editor for a variety of journals in that field. Irene Ward is research coordinator for the brain injury program, so perfect for this presentation. She works at the Kessler Institute for Rehabilitation, and she also is a doctorally trained physical therapist and clinical assistant professor at the Department of Physical Medicine and Rehabilitation at Rutgers University's New Jersey Medical School and the Seton Hall University School of Health and Medical Sciences. She's board certified clinical specialist in neurological physical therapy and works, I mentioned this clinical practice guidelines keeps coming up, specifically for the Academy of Neurologic Physical Therapy for the American Physical Therapy Association. So we do have questions that Chika, Patricia, and Irene have specifically prepared, but I do want to address some of the questions that have come in from the audience. So I think, Katty, let's start with you, and if others have additional information to address these questions, that'd be great as well. So the first one is, does anyone have references about what percentage with people with disabilities from rural areas or underserved populations have as far as using Facebook or social media? Is this really a tool that they gravitate towards?
I don't have that off the top of my head. No, I don't. Certainly, I think that we've been discussing that more and more at the office related to rural areas and internet access, simply because of the social isolation that we're all experiencing right now, and seeing innovative things that people are doing, schools that are parking school buses with Wi-Fi in areas for students to access the internet. So I know in Virginia, they're trying to do more in that area about bringing high-speed internet to rural areas in Virginia. So that's not really an answer to your question, but it is most certainly an issue and a concern. I don't know whether any of the panel would like to address that or not.
Hi, it's Irene here. I don't think I have anything additional to that, but I do have sort of a follow-up question if we have time, because I think, I was thinking a little bit about how Facebook is an excellent resource and probably helps solve some accessibility issues, but it may also present with other accessibility issues. So the question about, do people in rural areas maybe who have less access to maybe Wi-Fi and things like that sort of resonates in my mind as well. But sorry, I don't have an answer necessarily, but more of a question to add to that.
I think one of the things that I didn't mention as far as implications for future research, I did mention looking at recruiting participants who had, were getting VR services or supported employment services. Certainly for I think about individuals, for instance, with intellectual disabilities, you know, pairing that person with a mentor where they are so that they could take advantage of Facebook certainly is something to consider for individuals that have accommodation needs, is important to consider. We didn't have anyone in this particular group that expressed any accommodation needs. We did have tech support available for people who needed who actually needed assistance joining the group. They couldn't figure out how to join the group. So I did have tech support available if people had questions, and that was provided as part of the study.
Okay, and this is sort of related. It's from Jess Chika. Some of you may know her from the National the National Rehabilitation Information Center. NIDLA grantees are familiar with that site that we call it NARIC. And she was wondering, kind of related to this. I mean, this doesn't necessarily mean rural, but if people don't have reliable access to the internet, whether it's because they're lower income or rural, I mean, we're just kind of elaborating on this issue of, you know, what do you do when you can't use the internet besides trying to provide internet? Have you, you know, found that multi-pronged outreach is important, or any, Katty, did you have any? I mean, I know you've done millions of studies over the years, so even before the internet, right?
Well, you did indicate how long I've been doing this.
That's the bio you gave us, right?
I'm getting rather long in the tooth, Kathleen.
Aren't we all?
But I always say I'm not done yet. You know, I don't know whether I have any. I think this is one strategy. You know, it's offered as a strategy that has potential for this. I hope this doesn't sound like a cop-out answer to this question. You know, for me, it's one strategy for people who do have, you know, access to the internet. It's not a, you know, it's just like not everybody is going to want to read a fact sheet, or not everybody is going to want to sit in a presentation. I think it just adds a strategy to our toolkit. That doesn't mean that we should not be concerned about the people that don't have access to this, because clearly I already started out in the beginning talking about the social isolation feature of disabilities to begin with. So I really don't think I have an answer other than to say that it's, you know, it's certainly not going to be a strategy for all.
Sure. Lauren Smith from the RTC Rural, which is another NIDLR funded project, is noting, this isn't directly related, but we developed a website called Telecom Toolbox, and she puts the link in there, Telecom Toolbox, ri.umt.edu, as a resource for vocational rehabilitation counselors and consumers to help use different online platforms to communicate and for online career development. Note, we stopped updating the website in 2018, so some of the information about social media platforms may be outdated. As we know, you know, these things do move quickly. So this might be a good time to seg to Chika. I know that you've been involved in recruiting people to help develop clinical practice guidelines. Are there any strategies that worked well or not for you in as far as reaching hard to reach populations?
Thank you for that question. But I will start with saying that when it comes to guideline development, it's a higher tier and a ladder of evidence synthesis and knowledge translation. So most of the times we don't work with the patients, the primary people. So we work with evidence that is already there and we synthesize it. But even at that, my role as a methodologist and guideline specialist, working with the program in evidence-based care, we work on cancer, mainly cancer topics. And so my department, the program in evidence-based care, has been around for about 25 years now. And in these 25 years, we have developed established contacts and channels of communication with target users and target audience. So that makes our work a lot easier. Like I said, it's not always going lower to the, let me retrieve that language. We don't go to the patients because it's a higher, it needs a certain level of expertise that our the patient all of the patients might not have. And even when we need the patients in our system of connections and channels, we still have a pool of patients and a pool of experts that we can reach out to anytime we need to develop any guideline. So most of the time we don't use the social media because of the systems that we've already established. But I can see from today's presentation the usefulness of Facebook and social media in this area. So it could be something that will be looked at.
Sure. And Patricia Hain is pointing out too, it might be that different platforms are good for reaching different people. Like if you want younger generations, that Instagram or Twitter might be a better way to reach out. And I've also seen increasing use of cell phones, even though not everybody has internet. Throughout the world, almost everyone has a cell phone. So that's another area to explore that I personally don't have experience with, but I've seen it in other studies. So talking about the different platforms, one reason, we're talking about how different demographic groups sometimes gravitate toward one or the other. And I think Patricia Hain might be able to comment about the importance of having a peer mentor, right? Like the Facebook group participants, the moderator in Caddy's group was Jay, who was a TBI survivor. And so that shared experience was one of the things that the participants really liked best about the group. So this relates to the importance of having stakeholders as collaborators in a research study. So, kind of speaking or off of, what Chika was talking about, how have you involved stakeholders in your research projects or when developing clinical practice guidelines?
Definitely. Thank you for the comment. It is so important to develop that trust. So by including the stakeholders, you not only are given an opportunity to hear what are the real issues and how we can accommodate and facilitate the knowledge, the technical expertise, and their understanding in a way that they can use, but also to gain that trust and the relationship. So in terms of our projects, we have projects that have different goals. And so depending of the project and the stakeholders focus, we definitely include them in the process since the beginning. And sometimes if the knowledge is not well established, if there is an area that needs more that foundation, we actually do a focus group and start to develop that even before starting the project or developing the protocol. So it's key to include the stakeholders and identify the different knowledge and the expertise, including the population, the stakeholders, the patients, consumers at a different stage. You might need to approach different consumers, like from the patient, the person who has the condition, from the professional who works to serve the person. So you might have to do more of a multi-disciplinary context of including all the different stakeholders in the process. So it's extremely important for that, and especially to develop that trust in a way that the knowledge will be useful and they will help you, they will partner with you in making that knowledge accessible and also to promote and disseminate among their own groups.
Thank you, Patricia. Getting back to, this issue of differential access to the platform, Lauren Smith is commenting she doesn't know of any rural disability-focused references or stats on social media use, but the Pew Research Center usually has quite interesting stats. This link has social media, internet broadband, and mobile technology among different groups, but not people with or without disability. And Robin Brandt noted that Pew has also provided information about the digital divide and that the CDC has been using cell phone numbers to contact people to participate in surveys. So Irene, your work, you work specifically with people with traumatic brain injury, just like we heard in this talk. So what's your approach to tailoring and varying information strategies for people with traumatic brain injury whether you're developing clinical practice guidelines or other kinds of documents?
Yeah, thank you for inviting my comments on that. It's interesting to hear some of the similarities that in terms of our approach in including basically patients or family members in some of the cases in guideline, specifically in guideline development. So I guess thinking about guideline development, there have been a couple of different ways where we've included people, sort of like the stakeholder, either it's the patient or the family member. One was generally in terms of identifying the topic, that's typically done through the need of identified through by the clinician. So speaking more specifically about the Academy of Neuro-PT, there's usually something directed from practice, something that there's a need identified through practice. But once that topic is sort of a rough idea gets shaped, in one case at least, we're sort of, I guess you could say, newer to the CPG area. So we have, I think, about 4 now out and a few more in development. But in one of them, they involved stakeholders during the development stage. So they had them part of the steering committee to see what is it about the outcomes in which therapists are doing during your sessions, what are the outcomes that you care about when you're seeing a physical therapist, and what are those domains? So that helped shape the scope of that CPG. In terms of the CPG that I specifically was part of, I can speak a little bit more in detail of some of the things that we did to engage those stakeholders. So we brought them in once the document was written, but not yet out for public comment, for their review. And we needed some guidance. Because basically these documents are huge, and there's a lot of information in them. So all of our reviewers needed a little bit of a guided tour onto what exactly you were asking their input on. But specifically for the patient stakeholder, we wanted to know what they thought in terms of feasibility. So if the evidence says that this is the intervention to do, what was their take on that in terms of maybe willingness? They're sort of starting that conversation about engaging the patient in that decision-making of treatment, and what would be some of the issues, the feasibility issues on their part in terms of the intensity of that session or the frequency of that session. So we engaged stakeholders in that level. So it's really been about identifying the scope in some cases, certainly in the review process. We've talked a little bit more about having that become more evident earlier on. So not just in the review process, but earlier on in reaching out to professional organizations where people are members, like the Brain Injury Alliance of New Jersey, which is where I'm located, or other organizations like that, where people are active members and are seeking this information and can really provide valuable information. So that's one way we've tried to engage people, but also think about sort of how we can do that better in terms of engaging people in terms of guideline development.
Yeah, and I know we have Patricia here from the Cochrane collaboration, which is an organization that shepherds systematic reviews. So I know they have a group on aging that has also, I've attended some sessions where they try to get input into what should be the outcomes that are included in a systematic review itself, so that even as you're synthesizing the information that would be then fed into that patient provider conversation you're talking about, that, from the get-go, we're getting that consumer involvement. We do have a question from M. Rose for Irene. How did you deal with privacy issues regarding those clinical practice guidelines? Was it acceptable to the organization to have that information in a public access site like Facebook?
Well, I'm not sure I'm understanding the privacy question.
I think M. Rose
So
might
maybe just the reviews were private in the sense that they were not posted. So we did when we had somebody review it, whether it was another health professional, another stakeholder from another discipline, or a stakeholder, former patient. Those reviews were private in the sense that sort of how a journal would do it, where we sent them the manuscript, whatever their preference was, electronically. They could either submit a survey that we had a sort of a guided review, or they can write on it and submit it back to us in whatever format they wanted. But those reviews were not public. And I'm not sure if that's kind of covering the privacy question.
I think so. I'll let M. Rose. Yeah. Okay. So they weren't posing the review he put in.
No.
That does raise another issue that I have heard presentations for at the Americans with Disabilities Act Network conferences, where, and this, of course, Katie, this is why maybe you had a closed group, that as people engage in disability-oriented communities on social media, they may, in effect, be disclosing, and this can come up. I don't know if employers are supposed to do that, but many of them do check out social media profiles of applicants. And so, for example, if you were attending an event for the Susan J. Komen race and wearing your pink, so then there you go, that's out there and everybody knows that you're a cancer survivor. And what is the implication of that? So I agree with Emrose. I think, there are a lot of privacy considerations that need to be taken into account as we design these kinds of outreach strategies. So I don't know if that has come up in anyone's work.
The only thing I would say, Kathleen, is that, we were very concerned about confidentiality, and that is why we chose the, now called private group, which was secret group at the time, because we did not want in any way for the individual essentially to disclose their disability on Facebook, for sure. So that is why we chose that. And it was a research study, and excuse me, and VCU IRB certainly reviewed the study related to confidentiality.
Absolutely. And thank you. Patricia Hain is putting in some information from the Cochrane collaboration that is relevant. I don't know, Patricia, you want to explain what these things are exactly?
These are some of the resources from the Cochrane that they are related to engagement or the plain language, in a way like the information is useful and adaptable to the target population. So seems like a good resources to add to the panel today. Thank you.
Yeah, absolutely. Thank you, Patricia. I would put in a little plug. AIR also, in addition to this Knowledge Translation Center, houses the PCORI Knowledge Translation Center. I put PCORI in there, the Patient-Centered Outcomes Research Institute, which has developed pretty robust resources for how to engage stakeholders in these kinds of issues in developing clinical practice guidelines, or making sure that when there is a review or a research product, that that plain language summary is not only developed and pushed out, but that it goes through cognitive testing, so that they will take the language and sit down with the target audience member and think through, have them read it and explain, is it really conveying you know, the terminology, the content that it intends to convey. So those are some good resources and models there. And thank you, Patricia, for that extra guideline as well. So one thing, you know, some of you have also noted that there may be an age correlation, that Facebook users skew older versus Instagram or other platforms. And full disclosure, I am a mother to teenage boys who are very active on Instagram and TikTok, which are very visually oriented. So I wonder if anyone could just comment on that aspect of social media with respect especially to disability. You know, how do you see the pros and cons of more visually oriented trend in social media platforms universally? I mean, have any of you tried to deal with that, or no? Well, I can tell you that we did post in the agenda, if Anne or Joanne, you could put the link that we have to the day one links that came up in the chat then, because there are some accessibility guidelines related to Facebook as well as Twitter, and they would address some of that issue of, you know, how to handle posting on Facebook visually or any of these platforms. I haven't seen anything. I don't know how TikTok deals with accessibility, if at all. We do have a comment from Sarah McDonald, who notes that the Institute for Work and Health is doing research on the school to work transition of youth with disabilities to better understand what helps and hinders sustained employment. Recruitment success through our own Instagram and Twitter was limited. Better was establishing relationships with organizations that support youth and people with disabilities who directly reach out via listservs as well as their own social media feeds. So, you know, I think it does speak to what we've been noting, that any one platform is going to have a particular audience, and depending on where you want to go, you may need a multi-pronged outreach. Sarah says, as researchers, we don't have that audience in our social media. Sarah, sorry, what audience? The youth? And this is the link to the day one, the document we created. Yeah, Anne just put it in there so that y'all can download that and take a look at that in case it's useful for all of you. Jess is pointing out, I think it will, Jess from NARIC, I think it will also depend on whether you're aiming for conversation, interaction, or just distribution. Yes, very good point, right? We are talking about social media. So the whole, one of the premises often is that you are engaging in interaction and creating a community. And if that's your goal, great, but maybe it isn't. Maybe you are just trying to push out something and, you know, kind of have more control over the whole conversation than you might have on a social media platform that's open to anyone. Joanne is pointing out having youth on CEC helps. I'm assuming CEC is some kind of advisory board or something. Child Bright projects do this. If you could clarify, Joanne, what CEC is, that would probably be Community Engagement Committee. Thank you. Okay, so I just, you know, does anyone else, Patricia, Irene, Chika, or Callie, is there anything else you want to add? We are coming to the end of this session and about to go to break, but we do have about a minute.
Yeah, I think it's very important to define the audience from the start, because when you define the audience, then you will know where to find your audience, if it is in the social media, or you can find other means, figure out other means strategically to reach to your audience. But because social media is good, like you alluded, the younger generation seem to use it more than the elderly. But there are some of the, especially in guideline development, some topics will be mainly towards the elderly. So going on social media for that will not yield anything. So defining the audience and, like Patricia said, and gaining their trust, I think will be the key to a successful use of social media.
Absolutely. Thank you, Chika. And I think that, noting the importance of trust is a great way to close out this part of the afternoon. We are going to go to break. Thanks very much.